I don't think I'm the only person who feels like we're in crisis right now.
Across the country, we are seeing shocking federal actions that are targeting the civil rights and healthcare rights of millions of Americans.
Immigrants, our elders, Black, Latinx, and other communities of color, people with disabilities, and other historically underserved communities are under attack.
The federal government is trying to dismantle our healthcare system. This big bad bill and its related policies are going to strip healthcare coverage from one of every 20 Washingtonians, and it's set to decimate our health safety net.
These are not abstract cuts. 55,000 refugees, asylees, and other lawfully present immigrant Washingtonians will lose their current coverage in the next year alone unless we act. And these are not cuts that will happen to someone else. They are going to happen to our families, our friends, and our neighbors.
In each of our lives, there are loved ones whose health, safety, and security is really at risk. But we know losing healthcare coverage is only the tip of the iceberg.
Right now, our democracy is spiraling. SCOTUS has approved racial profiling. Masked ICE officers are disappearing people off the streets.
Elected officials are slipping into authoritarianism, and we're even learning our college institutions, our artists and media, they're beginning to take the knee. How can we possibly focus on healthcare at a time like this?
The answer is that healthcare is part of what got us into this mess, and it is part of what will help get us out of it. Let's be honest, there is a direct line between the audacity and hope of a Black man who promised America comprehensive health reform 15 years ago and the boot on the neck we are experiencing today, which is intended to put us back in our place.
All of that stuff, it's not going to work. It's not going to deter us.
But know that here in Washington, we're not standing still. Good work is often quiet until it garners results.
With NohLa, we're hoping that you're going to join the fight with us. You're going to step up with us and our community partners and our community friends and defy what's going on right now.
It's because we know deep in our core that health is a basic human right.
For Henry Shue once articulated that health is a human right because it is an essential precondition for every other freedom or right that we claim today. It's like needing food, water, and shelter. Healthcare is a moral minimum that is necessary for a just society.
Now, this is the point where you might wonder if it's true that Americans understand that health is a human right, then why have we seen so much pushback in the wake of the Affordable Care Act and the pandemic? The answer, of course, is that we haven't gone far enough.
Maybe we need to truly confront the hypocrisy of this antiquated healthcare system that profits off denying care. There's a reason why Luigi Mangione, Martin Scarelli, and the shackles are household names. There's a reason why Americans don't trust their doctors anymore when the doctor is controlled by a multinational conglomerate who looks at profits year over year instead of the growth and the health of its communities. There's a reason why Congress axed health insurance for 14 million Americans.
Too many people shrugged and said, what good is my health insurance doing for me, anyways, when I've got a $6,000 deductibles and every year I get a double-digit premium increase? That is why we know we can dig out of this crisis, but only if we are bolder than we've ever been before.
A lot of hard work to turn this moment into a healthcare movement. But we're up for the challenge and we're already working alongside many of you. We're starting with a 5-point plan in 2026.
First, we will not slip backwards in our state's commitment to the health safety net. This year, we expect another multi-billion-dollar state budget deficit on top of the coming federal cuts. We're hearing rumblings that both parties are considering cuts to basic health care. It's our job to remind them that we didn't put them in office to cut care for our immigrant neighbors or people struggling to live with dignity through poverty. Second, we will be relentless in our expectation that everyone shares responsibility for our health safety net. Even with the federal cuts, there is enough money in our great state to make sure that every Washingtonian has basic care that recognizes their humanity. Right now, many big corporations are accumulating profit from our healthcare system. For some, that looks like shirking their duty to provide affordable coverage to their workers, and for others, that looks like sitting on piles of reserves that could go to care. We're going to ask everyone to do more.
Third, we're not going to let this crisis distract us from the corporatization and consolidation that is rapidly changing our local doctors' offices into private equity-backed stripped malls. Especially now when our healthcare system is so weak, we need guide rails that will help us understand who owns and controls our healthcare and who is setting this price tag that just keeps getting higher and higher every year. Fourth, we're not taking our eye off the access challenges that put care completely out of risk for so many of us. We will continue shining a spotlight on the provider network shortfalls, excessive prior authorizations, and care denials that are rampant in today's system. There's a lot of talk about the promise of AI and other technologies, but patients don't need another biased algorithm telling them that they can't get care. There's already plenty of that happening by able-bodied humans.
And fifth, and finally, we will leverage this moment for transformative change. We aren't fighting for today's healthcare system because, frankly, it's not working for everybody. As we build back a safety net for all Washingtonians, we are not interested in building junk on top of junk. With every policy decision ahead, we will ask, does this get us closer to our
We're up for the challenge, and we're not doing this alone. We're counting on the power of our community.
allies and all of you?
We're looking for additional advocates and supports with the power to help us move these mountains.
We're going to be with you for the long haul to do it.